Part of the brilliance of looking at naturally occurring retirement communities, or just the opportunity really, is that when you have a whole bunch of people who live right next door to each other, just separated by a wall or a ceiling, how can you start to build the type of connections, that might start as a hi in the hallway or a wave, but maybe over time escalate to deeper relationships that can help sustain independence for longer and having that network available to you right in the building.
This is Coming of Age, Meeting the Needs of Our Aging Population, a podcast about how we can better support our seniors. I'm your host, Donna Duncan. I am also the CEO of the Ontario Long-Term Care Association, which represents about 70% of long-term care homes in Ontario, Canada. This episode was generously sponsored by our sector champion, Arjo. Welcome back to a new episode of Coming of Age. Throughout this season, we've heard from experts about how older adults are looking for more choice and options as they age, from where they live to how they access health and community services. In Canada, we're also seeing an increasing number of older adults choosing to live in urban environments, with more people living in apartments and condo buildings than ever before. When there is a large number of seniors living in a building, this creates what's called a naturally occurring retirement community, otherwise known as a NORC. These naturally occurring retirement communities were an inspiration to Open Lab, an innovation hub in the University Health Network, Canada's largest research hospital. Open Lab's NORC Innovation Centre is developing programs in Toronto that promote health and well-being, reduce loneliness, and coordinate services with community partners for people living in NORCs. Interventions such as these are helping to make it possible for more seniors to continue to live independently. In this episode, we've invited a researcher and an innovator for a discussion on naturally occurring retirement communities. Dr. Paula Rochon is the founding director of Women's Age Lab at Women's College Hospital in Toronto and professor of medicine and chair in geriatric medicine at the University of Toronto. Jen Recknagel is the Senior Design Lead and Director of Innovation and Design at the NORC Innovation Centre in the University Health Network. We'll explore what they've learned so far. Let's dive in. Welcome, everyone. I am so delighted today to be joined by Paula Rochon. It's great to have you return this season. And we're also joined by Jen Recknagel. So welcome to you both. I'm so delighted to be able to have you join us today. And I'm wondering if we could start off by defining exactly what is a NORC.
So naturally occurring retirement communities, it really is just a geographic designation for an area such as a building or a neighborhood where there's a naturally high density of older adults. There's a difference between a NORC, which is really just a geographic term, and NORC programs, which is making use of that density to bring in place-based services, to look at social inclusion, and to look at delivering more robust programming to support aging in place.
So yeah, as Jen has said, naturally occurring retirement communities are places where there's sort of a large concentration of older adults living in a single space, often a high-rise building or a condominium. We've defined it, I guess, a little bit more, talking about generally the numbers around, say, 30% or more of so-called older people living in one of these buildings. The interesting thing, or one of the interesting things about these naturally occurring retirement communities is the majority of residents tend to be women. And, part of that is because, women tend to outlive men is one of the pieces. But that's an interesting additional piece to think about when you're looking at NORCs.
And do you have any examples about what a NORC is? Is this largely an urban phenomenon?
we've talked about it primarily as an urban thing. And I think many people will sort of say, yes, I think I am living in a NORC, because they recognize that there's a large number of older people living in the same building as they are in. But NORCs can also happen in sort of more of a flat environment as well. It can be a community where there's just a large number of older people living in an area. So it doesn't necessarily have to be a high-rise building, and doesn't necessarily therefore have to be in an urban environment. But I think the urban environment is where we're more likely to see these.
I'm really interested in any research, Jen, that you're doing in this space.
At the NORC Innovation Center, we've really been looking at Statistics Canada data that shows that more and more older Canadians are choosing to live in urban areas, and they're choosing to live in high-rise buildings more than ever before. Our analysis of Statistics Canada data show that in Toronto, for example, 36% of older adults who live alone are now living in high-rise buildings. And that similar trends towards high density living are happening across Canada. Mostly as a result, we've been really focused on looking at naturally occurring retirement communities that are high rise or vertical NORCs because of this trend. We've been mapping these high rises in Ontario, and there are more older adults living in NORC buildings in Ontario than in long term care and retirement homes combined.
Wow. And it's interesting because as we talk about aging in place and the shift to high-rise buildings in urban centers, aging in place doesn't necessarily mean aging in your family home. Would that be fair?
I think the notion of aging in place is really aging in the community of choice and in your place of choice. More people are, culturally not needing to stay in the family home like they did in previous generations. There's an acceptance or an understanding of, I don't want to go up and down the stairs anymore. I can't really take care of the yard on my own. I don't need this much house. I'm going to quote unquote downsize and move into a condo or an apartment building. Some folks might not have saved enough financially for retirement with cost of living going up, and maybe need to get the equity out of their home and choose to rent. So there's a number of reasons why older adults are choosing to live in high-rise buildings and in urban areas. We also hear, I want to be closer to amenities, I want to be closer to hospitals. So I think that's partly what's contributing to this trend towards older adults living in high-rise buildings.
And Paula, you touched on the gender factor earlier, and that a large percentage of those living in NORCs are women. Are they single women? Are they married? Do they still have a spouse or a life partner with them? Or are they moving because, to Jen's point, this is too much house for me. I'm on my own now. I want to be in a different kind of setting. Are there other considerations around that gender orientation in a NORC, Paula?
Yeah, I think that people talk about, how they see themselves as they're getting older and where they would like to live and how they'd like to see things shape up for them. People talk about all different ways they might want to do it. You hear things like, for example, home share opportunities where people may be thinking about having people come into their homes and live in their homes. And sometimes it's, for example, a student who needs accommodation and an older adult who may have a home that they want to share. And it's a bit of a win-win where they're bringing in companionship, but at the same time, also getting some additional income. But for many other people, as Jen is saying, houses are a lot of work, and, things like snow, which we have to deal with in the wintertime, just some of the repairs, it's a lot to do. And I think a lot of people are just making the step to think, okay, let's move into an apartment or a condo where you get rid of some of those different kinds of complexities. And as people get older, we know, there's more likely to be women in that circumstance, and it actually may be women who particularly might find it even a bit more difficult to manage in their homes. And the women that we're seeing, and we're just starting to look at some of these things, are more likely to be alone. They're more likely to, for example, no longer have a partner, which kind of relates to some of the work that we're doing here together, Women's Age Lab, along with the NORC Innovation Center and a variety of other places like the City of Toronto and the City of Barrie and public health units and libraries, are looking to start to understand a lot more about these naturally occurring retirement communities, and who's in these communities, and trying to understand not just the fact that people are living in these spaces, but what are the different kinds of enhancements or programs that you might want to bring into these buildings that the residents would like that might help with some of the things that are important to them. For example, how do you promote social connections? Like, what are the things that people want in these buildings to promote social connections? Like, could it be a book club? Could it be coffee groups or whatever it is that people might want? How do you promote or bring in that kind of activity to help people with social connections? Or things like physical activity that's so important for health and well-being as people age. How do you take advantage of the fact that these people are living in these settings and to find out what actually works to improve their health and well-being? So it's a huge opportunity, especially for women.
One of the things that we struggle a bit as we talk about naturally occurring retirement communities, aging in place, is the fact that so many older people are not anticipating that they will have any kind of critical health need where they would be prevented from aging in their own home. And so they've not planned, they've not had discussions with their family members with regard to the type of supports they may need. They likely have not done any kind of financial planning where if they needed 24/7 home care, that they would be able to afford it. But at the same time, we know from the long-term care side that with a wait list of 40,000 people in Ontario today, what are some of the considerations as we support those individuals in NORCs with far more complex care needs in a home environment? We've certainly done a lot of work with our membership at the Ontario Long-Term Care Association in looking at who's in long-term care today. And as I said, the average age is 81. So much older people are coming into long-term care, very, very complex needs, which means the 40,000 people who are waiting on a wait list are waiting at home. And what are the services and supports they will need? Because we certainly see a path where much older people will have no place to go but home as they wait.
I think that the most interesting thing about the naturally occurring retirement community model is that you are looking at ways to support older adults where they already live and where they want to stay. And so the NORC Innovation Center, we're part of the University Health Network, and we've been designing and are now rolling out to try to understand how it might work an integrated model of health and social care. So we're really looking at how can we support residents, older adults living in naturally occurring retirement communities with health and social care needs. It is primarily a health prevention, health promotion model where we're looking at how can we help people, older adults, stay healthy? How can we help slow functional decline? How can we help people get access to the services that they might need and information that they might need in a more timely way? Around how to better self-manage at home to prevent some of the types of decline that might land people in the hospital or expedite the need for more intensive care. And so we're right now testing out a model where we have a coordinator in a NORC building who's working with the population of older adults to understand what it is that that local population might want or need in their building to stay healthy. And so that could be health related talks or workshops. It could go as broad as understanding fraud prevention. It could be on pain management, cooking for somebody who has diabetes, how to have a better diet. It could be, as Paula said, exercise. We're also looking at bringing in group health clinics. So, when you have a density of a similar population in one location, what are some of the top needs? Well, foot care is a huge service that a lot of older adults need to stay healthy and stay independent at home. But we're also looking at things like vaccinations and bringing vaccination programs into NORC buildings, as well as looking at things like social activities to help encourage the building of social networks. We have seen that more and more, just as the demographics have changed, you know, most informal caregiving usually fell to the shoulders of adult children. And we're seeing that older adult children are having their own children later in life. They're living in dual income families, so they're not as available to care for their aging parents as in previous generations. And so part of the brilliance of looking at naturally occurring retirement communities, or just the opportunity really, is that when you have a whole bunch of people who live right next door to each other, just separated by a wall or a ceiling, how can you start to build the type of connections, that might start as a hi in the hallway or a wave, but maybe over time escalate to deeper relationships that can help sustain independence for longer, and having that network available to you right in the building. For those that are having more complex conditions, we are looking at a virtual care hub that's a nurse practitioner led model, where people who need better access to services, who maybe don't have a primary care physician or are having trouble managing chronic conditions, can get connected with a nurse practitioner who can support them to get connected to the right services.
Paula, from your perspective, how do we support this growing demographic at a time when we know that 80% will be fine, but 20% will have more complex needs? There's going to be greater pressure on this system in terms of supporting a higher level of care at home.
Yeah, I think Jen has outlined a number of the things that are going on that are really interesting to think about. But we also need to think about how to make this sustainable and how to make it work in a variety of different areas, So one of the things to think about is, these different services that people might need may differ in different communities. So how do you make sure that we're accessing the services to help people in their local communities? Because we need to take advantage of the services that already exist to make this a sustainable thing. I think we can't afford to bring in all completely new services, right? We need to build on the services that are already there. And we need to really focus on getting the connections in place. So connections in place to the services that already exist, but also connections, for example, to things like primary care. And sometimes, people as they get older don't necessarily have those connections or have lost those connections.
I think that's a really interesting point, Paula, about the making use of what already exists and how do you make things more sustainable. A lot of what we've been trying to do together with the Women's Age Lab is to really look at partnering with local service, health and social service partners to say, hey, there's this building in your community where there's 200, 300, 400 older adults living. Is there a way to look at partnering to bring your services into the building to better support and to be that linkage to connect service providers who have a mandate to support older adults with these large groups of older adults who are wanting and needing these services, and on the other hand work with older adults to really try to identify what is important to them.
I met a lovely woman we were at a global aging conference in Scotland in the fall, and I met a lovely woman from just outside Glasgow, and she lived in what was, for all intents and purposes, a NORC. And she was in a very small low-rise apartment building, but her two sisters also had apartments in the building, and they would come together for communal meals. They brought everybody else together. They developed a culture within their building where they could have that social interaction, but also make sure that they could provide care for one another. Their kids were far away, so it was much older people. But are there opportunities for younger people in NORCs? We hear so much about these retirement compounds in campuses, especially in Florida, where it's only older people. Is one of the benefits of this that because they're naturally occurring, you can have more intergenerational interactions?
Yeah. I think that's a huge one, and one that I really love. I mean, I think one of the strengths of the NORCs is that you have older people and younger people living in the buildings, and the opportunities to learn from each other and to share, and just the opportunities to connect. It creates such a lovely environment. things like technology can be challenging. And I think you can imagine what it's like if you're living on your own and something's going wrong with your TV or your iPad isn't working or things like that. It's always nice to have someone to call on. And sometimes it's some of those younger people that are able to just provide different kinds of supports. People can help people in different kinds of ways. And when you know your neighbors and people are around, they're there to help you.
Mm. We hear a lot from older adults who live in NORCs. I want to be a full-fledged community member. I think a lot of older adults want to remain active citizens and want to remain part of the community at large. And so living in a building where you see families, where you see young people, where you see working age people, sort of it gives a sense of, life is on a continuum and we're all young and we're all going to grow old and that we all have a place. And part of the work that we're trying to do at the NORC Innovation Center is how do you create that broader sense of community where there's an understanding of everybody having a sense of value and having a way to contribute to a community at all stages of life.
Paula, we've spoken about this with you on an earlier podcast, the stigma of aging. We do have an opportunity as we think about this continuum of living and aging to prompt discussions.
Yeah, I think about ageism and gendered ageism, discrimination that people face both on the basis of their age and their sex, and women often experience both. But one of the strategies to address it is intergenerational pieces, and education is another big piece. And when you're living in an environment where you have people of all ages, you learn from people who are younger and you learn from people who are older. And you also learn, I think, that, people think that aging is something about only older people. We're all aging and it impacts all of us in different kinds of ways. And, people who are young can feel discrimination based on their age. Oh, you're too young, you shouldn't be doing this sort of thing. It affects everyone. But having everyone together, I think you do learn from each other. It just creates a much, much richer and I would say healthier environment.
Paula, both you and Jen referenced technology. So whether that's virtual care models and connecting individuals with nurse practitioners, whether it's technology that an individual will use in their home, whether that's their iPad or their computer, and being able to tap into younger people who are living in their community to help them with their support. Again, I'm going to reference my mother, who had a 14-year-old high school students who would come in and help her with her technology. We had on an earlier episode this season a digital living specialist from British Columbia, a fellow named Mike Agerbo, come on, who talked about how he was using technology to support his aging parents in their home. And so we're starting to see new innovations on how you can use day-to-day technology just to be an enabler. So there is some new innovation happening, and the youngest baby boomers in particular have a real comfort level with technology. It's becoming more normalized. And I'm wondering if there are other opportunities to think about how this rapidly changing space with technology could be one of the biggest enablers of all.
The technology piece is really interesting. And as part of the work that Women's Age Lab and the NORC Innovation Center is doing together, we're looking at how we can take advantage of the library services. Libraries are doing really, really interesting things and helping a lot of people engage with different kinds of technology. So, for example, just sort of starting at some of the basic levels, people are using now phones and iPads and computers, and often that's a way that people are connecting, for example, with their families that may, now families often live further away from where people are, and you may need this technology. But it's not always easy, and it's really helpful if you have somebody that can give you some support with that. And so people with different kinds of skills and people from, for example, the library and other kinds of groups can help people with some of the ability to make those connections using their various different kinds of devices, learning how to use their phone better and things like that. We're also recognizing, and I think this has become far more prominent since COVID, that so much of what we have to do now, for example, to get services or to make different kinds of appointments, even appointments, with your physician, requires technology. And so often people need assistance with that. Or in some cases, people don't have the technology. And another component of that is these things can be very, very expensive. And it may not be something that's readily affordable for people, but it might be needed to start making some of these connections.
I think, while there is growing use of technology and engagement of knowing how to use it, I do think that there's a lot of communities of older adults that, for reasons of equity, don't have access in the first place. So, in one sense, these digital futures where we have, GPS wandering and remote care monitoring and the fridge that talks to the bed that, that can sort of create this sort of digital future where we're monitoring all of these metrics and predicting. I think that this is a very interesting idea that does have a role, but what we're seeing is that's not the reality on the ground right now. There's still a lot of older adults who don't have access to devices, don't have access to internet, don't know how to use them. And so we're really starting with basic digital literacy support, how to use your phone, how to use the internet, how to, and then even providing access in the form of having a person in the building who can support people to make appointments and whatnot. However, we are also looking at, how can we distribute things like falls pendants, which is a huge request in a lot of the buildings that we're in, as well as looking at integrating remote care monitoring programs with escalation points into the system as part of the NORC program we're developing at UHN, as opposed to a lot of these technologies, I think are really geared towards the consumer market and are reliant on, again, adult children being the people who can set it up, being the people who can receive the call. But I think there's a future when you look at technology integration into the NORC building, where again, how can you rely on neighbors for that more nearby support? How can you have the formal system be connected to that building in some way to have a quicker response? How can we make use of better partners like the Toronto Public Library? In our case, community paramedicine programs are fantastic. And I know there's a lot of expansion of that in Ontario anyway, to create those sort of escalation pathways if people are having serious issues that technology can be helpful for. Yeah, and then there's other really wonderful things like memory care and interesting things to do with responsive gaming. And again, you mentioned home hubs like the Alexa, where people who have a hard time for dexterity reasons can't necessarily, or vision issues, can't engage in a computer in the same way, can just talk to the computer and sort of maybe book an appointment or have a call with a loved one more easily. So yeah, definitely a future there, but we are seeing that there is a sort of basic skills gap that exists currently that might not be the case in 10 years.
I think what you're saying, Jen, too, is technology is as a role, but the human piece is still so important, right? People want to have those one-on-one connections.
Well, I think you've both made such a great point, and so many of us make assumptions. And so how do we make sure that we're bringing a health equity lens and recognizing that very few people will be able to afford 24/7 specialized care?
Being from Toronto, which is a very diverse city with tons of different ethnicities and languages and cultural groups, I think one of the challenges we've seen is that in some buildings, there's a difficulty in forming a sense of community simply because people don't speak the same language. And there could be, prejudice that exists, stereotypes that exist, which happens across the city. So, how do you start bringing groups together who might have trouble communicating in a basic way with one another to form that safety net for one another in the building? And so that's something that we've been trying to understand how to do better as we work with communities. We've seen that in some buildings there are groups that can be dominant and others who aren't really as brought into the community. And so working on ways to open it up through having more cultural celebrations, doing some work to reach out to different groups within the building that might be representative of different language or cultural groups to sort of bring them into the planning process of, there's a NORC program in your building. We want to create an aging in place community and bring services in. How can we participate together and to create a catalyst and a forum to welcome people into that space and to have it be somewhat facilitated by a neutral third party rather than just a community to self-form, which some do beautifully. Really, we haven't really cracked the code yet on why some communities are very able to self-form and be very inclusive, and why some have a hard time and struggle with things like certain members of the community being overzealous or domineering and sort of hogging the mic kind of thing, and some are just really great at sharing and being inclusive. We have not cracked the code yet, but we are working on a program that we call the NORC Ambassadors Program, where we work with local residents to build their capacity in how to be a local leader and how to build an aging in place community, how to listen deeply to the needs of others. But there's a lot of focus on skilling people up in community building within their own NORC and to be aware of our own prejudice, to talk about things like how to help and how to receive help. Where are the boundaries? We're not looking after one another, but we're looking out for. And what's the difference? How do you be a good neighbor? How do you create a space that's open and inclusive to bring people in? And why does that matter? And so we are doing a little bit of that training to support older adults to be leaders on the ground in their own buildings, to listen to what their fellow neighbors want and need, and then being the connector, the system connector, to try to bring in those services with different partners that are already doing this in their community.
Jen, I think as you said at the start, there's more naturally occurring retirement communities now than there are retirement homes and long-term care homes together, like probably about 2,000, what we think naturally occurring retirement communities in Ontario alone. So that's a huge number. And one of the things I think we're doing with our work is we're trying to look at the diversity of NORCs. So some of them are condos, some of them are apartments, and some of them are deeply affordable housing, where people don't have the same kind of resources, but these are all very important settings of care. And we're also looking at some seniors housing where it's not exactly a NORC, but there's a large and mostly older people that are living in these buildings, and they have very different needs. And I think we're learning a lot about that. What are the things that people need in these buildings? And in some cases, it's issues of food security. And how can we work with providing access to things like fresh foods and vegetables that are coming in, during the different growing seasons? And how do we think about activities like that people might be interested in, like community gardens? So it's very much looking at the individual building and what are the things that people want and need, and how can we help support them with what those pieces are.
Your research is so timely. So one final question for you. How do we make these work at such a pivotal time? The Western world is not prepared for this aging demographic and the generational shift of the baby boom population. Would really welcome your insights on how do we spread and scale this.
We want to get these up and running, but we want to also understand, what are the pieces that are making them work, what works well, what doesn't work well, so that we can give people who are interested in doing this the tools that they need. People want to know how to enhance them with these programs and services to promote the social connections and promote physical activity and help people to age the way they want to in their home for as long as they can. But they don't really know how to do it. And I think that's one of the big contributions that we're going to make. It's going to help people, I think, understand how they can also move this forward as well.
It is important to understand that currently in Ontario and in Canada, there is no government funding for NORC programs at this time. And so part of what we're trying to do right now is to look at developing a model that can be brought and customized to local conditions, but to adapt and work with what's already happening in the system to help better scale and spread, and to really understand, how do you do that? One, how do you do that well? What are the best practices there? But then also, how are we impacting? And so we are looking across different domains, from quality of life to health and well-being, to understanding health system utilization and issues of health equity with our work right now, to understand how is bringing a NORC program into a community benefiting the system at large and people's health and well-being, until we gather some more impact metrics, as well as understand best practices for working with the diversity of communities. We're hoping to do that in the next couple of years, and then have more supports available for others to take our learnings and to implement in their own communities. And there's some really, amazing work happening already. And so I think there is a growing community of people who sort of recognize the opportunity of NORCs to bring in better place-based services and to create networks of support, and to address things like older adult empowerment, ageism, that we're trying to develop a network to share our learnings about what we're doing in Toronto together.
It really is exciting, and it's such a pivotal moment. What you're describing is really a more holistic approach that is about how we come together as communities to support one another. And so I really want to thank you both, Paula Rochon, Jen Recknagel, for your leadership on this. I'm very excited to follow your work, and thank you for sharing with our listeners.
Thank you so much, Donna. Lovely to talk today.
Yeah, thank you.
Thank you for listening to Coming of Age, the podcast that is changing the conversation on seniors' care and aging. We hope this episode brings a new perspective and inspires you to continue the conversation with your colleagues, friends, and family. Be sure to subscribe, rate, and review the podcast so that more listeners will join our community of changemakers in seniors' care. Until next time, I'm your host, Donna Duncan. Keep well. This episode was generously sponsored by our sector champion, Arjo. Arjo believes that empowering movement within healthcare environments is essential to quality care. With products and solutions that are designed to promote a safe and dignified experience through patient handling, medical beds, personal hygiene, disinfection, and the prevention of pressure injuries and venous thromboembolism, Arjo is committed to driving healthier outcomes for people facing mobility challenges. Learn more about Arjo solutions at www.arjo.ca.